Hi there. Can anybody hear me out there? If you can, shake your head, raise your hand. Just want
Yes,
to
we
make
can hear you.
make sure the audio is working. I'm going to wait just a couple minutes to see if there are more people that will join. We are, it's not going to be a very long presentation today. Can you guys see my screen with our logo and Achieve Healthy Aging?
Yes,
And
yes, we can see it.
if I change it, does it change with how I'd like it to?
Yes.
The slides are changing. Okay, good. The last time I had a little bit of difficulty with it, so I want to make sure get that lined up. So we'll give it a few moments here, see if any more people jump on here. We'll probably get started about 1:05. All right. Well, thanks everybody for coming. It looks like we don't have a huge crowd, but it looks like we have some important people here. So I appreciate you guys joining for our presentation on the Achieve Healthy Aging study. So this is something that's recently come out, or at least its results have come out, and it's a more of a long-term study. But we're going to look at the first 3 years of some data, and it's not too complex for what it's worth for what we're doing here. But we thought it was useful to share with everyone and everyone that's experiencing hearing loss and is treating it in the proper fashion. So I guess I will go ahead and get started. Most of you know me. I'm Dr. Ryan Hill from the Hill Hear Better Clinic, and I've seen most of you. There are a few names I don't recognize, and that's okay. You probably see one of our other great audiologists. So thanks for joining us today. So what is the ACHIEVE study? So this is the Aging and Cognitive Health Evaluation in Elders. So they called this a landmark study of the effect of hearing intervention on brain health in older adults. So it's a large-scale randomized controlled trial designed to determine if treating hearing loss in older adults could reduce the loss of thinking and memory abilities that can precede dementia. So we know hearing loss and tinnitus, well, mostly hearing loss and untreated hearing loss can leave us at a 200 to 500% increase in the risk of things like Alzheimer's and dementia, which is pretty huge. And we know it's the #1 modifiable risk factor for those conditions. So it's not the #1 risk factor, but #1 modifiable. And you've probably heard us discuss that before or read some information about it. So we just feel it's really important to share our knowledge and all the information that's coming out with our patients. So the purpose of the study was to determine if treating hearing loss in older adults could reduce cognitive decline over a 3-year period. Pretty short, but some of the results are pretty significant. And it also looks at the effects of treating hearing loss on other health outcomes, which include mental health and well-being, physical function, and the use of healthcare. So the population study was a group of adults who were already participating in a heart healthy study and a group of healthy volunteers who were newly recruited from the community. So the 238 participants who came from the heart health study were, on average, older and had more risk factors for cognitive decline than the 739 new healthy community volunteers. 490 participants were assigned to the hearing intervention, and 487 were assigned to a health education and control intervention. So we'll talk about more of the heart health study, the risk factors, and the healthy community volunteers here. We'll get into a little bit more detail, and we'll answer any questions at the end about anything we've covered today as well. So the interventions, participants were randomly assigned to either a hearing intervention or a health education intervention. Both interventions were delivered through 4 one-hour sessions spread over 3 months and booster interventions at semi-annual visits. After the 3 years, participants were offered the other intervention, so that part is still ongoing. With the hearing intervention group, best practice hearing intervention programs were introduced. It was evaluated by speech and noise performance and perception of disease-specific self-report measures. So there's some questionnaires that they filled out and data was collected from those. They were also evaluated for compliance of the intervention, so how well they used their treatment or which group they were assigned, how well they followed along with the protocols. And they were delivered within a specific reasonable time frame. So information and guidance provided by a toolkit of written and video materials to improve self-management of hearing loss and communication techniques. So the health education control intervention group followed a protocol and materials for the 10 keys to healthy aging used by the CDC. This targets the causes of disease and disability that could be greatly reduced or eliminated to promote healthy aging in older adults. Participants met with a health educator in order to learn how to take charge of their health and well-being. So examples are immunizations, screenings, and body maintenance. The principal investigators of this were Frank Glynn. He's a physician and a PhD for Johns Hopkins Bloomberg School of Public Health. He's a prolific researcher in the hearing loss field for many years. I've read many of his studies, introduced them in plenty of papers in graduate school, and continue to read his research. He's somebody that's really, like it says, prolific here in our field and has done great things as far as collecting information for interventions and also compliance with hearing loss treatment. The other person is Dr. Joseph Koresh, and he's another Johns Hopkins Bloomberg School of Public Health physician, and he studies risk factors of vascular disease across different organs, including the heart, kidney, and brain. So the heart health study patients were from his particular study. So the results, what Achieve found, is that in older adults at increased risk for cognitive decline, hearing intervention slowed down the loss of thinking and memory abilities by 48% over the 3 years. So we'll dissect this a little bit. So the hearing intervention benefited the heart health study participants the most. This is because these 238 participants from the heart health study were on average older and had more risk factors for cognitive decline. They're more in line with those seeking hearing help than a healthy volunteer group. So, we see those with hearing loss at a higher risk, and this lines up with that and with the information we've collected over the years. In the newly recruited healthy volunteer group, hearing intervention had no effect on reducing cognitive decline within 3 years. However, that's only 3 years and their risk factors are lower. That doesn't mean that intervention does not help them. It just means this study did not collect that data. So are there any long-term benefits? So measuring cognitive decline on heart health study patients is easier because they have a 3-fold faster rate of cognitive decline over the study period. Thinking and memory abilities change more slowly in a newly recruited healthy volunteer group. When these abilities change more slowly, it's harder to see if a hearing intervention program can further slow any declines in these abilities. So again, longer term studies are needed. So we can fully measure the beneficial effects of hearing intervention on reducing cognitive decline. Investigators believe that hearing intervention to have beneficial effects on reducing cognitive decline in the healthy volunteer group, which may take 3 or longer than 3 years to use. Again, another reiteration of that data. So what's next for Achieve? So they're continuing to follow the participants beyond 3 years to look at longer term effects of hearing intervention on cognition and other outcomes. So the conclusion is that the findings make a strong case for the role of hearing loss interventions in sustaining not just our ability to hear, but also our cognitive faculties. It's not just a hearing study, it's a leap towards a better quality of life for our older population. So how does hearing loss change our brain? We'll kind of dive a little deeper, but not too much further here, just the surface level kind of stuff. Hearing loss disrupts the normal pattern of activity between the ear and the brain, recruiting other senses and faculties to fill in missing information. So we call this cortical spatial reorganization. So as an example, an fMRI study, so functional MRI, where the brain is active and they're studying it real time, those with hearing loss show a higher activation of the visual cortex than those with normal hearing. We think of those people that are, when they're struggling to hear, they rely on lip reading and, different mannerisms, and also sometimes just the speed of the speech because they're not picking out all of the information. We saw with COVID, all the mask wearing, that people with hearing loss struggled even further because they could not see faces. So this illustrated that this visual cortex in the brain where we process, our visual cues was more highly activated than it would be if we had the full normal hearing scope. So the brain has to use more resources to come up with the same information it's seeking, leaving less energy and resources for memory, executive function like decision making, and emotions. This means those processing centers for cognition are not exercised like they should be, and they begin to atrophy. If you don't use it, you lose it. I don't really like that statement, but we use it frequently because it's pretty true. The brain is like a muscle, and those different parts of the brain associated for processing speech and sound are the same way. If we're not consistently feeding information or exercising it, the brain is going to dedicate its energy somewhere else. So the study here helped to show that if we could, use an intervention, we can slow this decline and continue to stimulate those portions of the brain. So how does it help kind of just discussed that, but it helps to reestablish and reconnect the neural networks responsible for processing sound and specifically speech. It helps maintain the neural connections already present, and it helps keep the decreased cognitive load on other parts, or it helps to decrease the cognitive load on other parts of the brain. So all functions can be used as designed, and the typical processing schemes can be utilized. This keeps us connected to our outside world, our family, our friends, and our coworkers. So other recommendations, not only does hearing intervention help, the CDC, FDA, can't remember the particular facility or organization that determines these guidelines, but 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity aerobic physical activity every week is recommended. Also, muscle strengthening activities on 2 or more days a week that work on all major muscle groups. So this just helps to prevent blood flow, which can, even before learning, can help you to retain information further and help those normal activities and blood flow through the whole system, through the whole body system, so that we can utilize them properly. And also eating healthy. I think we all know these things. It gets drilled into our head, but something we like to discuss as well with certain patients. And, we want to eat a variety of foods. We want to balance food intake with physical activity to maintain and reduce weight. And we want to choose a diet low in fat, saturated fatty acids, and cholesterol, and choose a diet with plenty of vegetables, fruit, and whole grains, so we get a hold of our vitamins and lower our sugar, salt, and sodium is the same thing for intake. Does anybody have any questions? It's a nice, short, sweet presentation today, but we thought it was really useful information and wanted to get it out there. Anyone have any questions for us?
Can you hear me okay?
Yes, sir.
Yeah, this is Dennis, guys. I was just I recently had a discussion with my sister-in-law who is beginning to lose hearing as well. When we got into the subject of the relationship between, because I remember learning this from you, Dr. Ryan, and the relationship between hearing loss and not aggravating, but exacerbating, not onset, but not helping with issues of dementia, your brain slowing down, not thinking straight, things like that. So earlier in your presentation, you talked a little bit about that. And I think I wrote down here 200 to 500% increase in risk to dementia. Can you go back and review that a little bit for me?
Yeah, so that was just more of an anecdotal thing here. It was just part of my notes.
Yeah.
So there's been some recent studies within the last 5 years that are looking at the increase in risk for things like Alzheimer's and dementia. And because hearing loss plays such a vital role in our emotions, our decision making, it's one of our primary senses for determining what's in the world around us and how to operate. And it also has ties to pretty much every function in the brain. So if we're not maintaining those particular connections, we don't have the same resources we used to. The brain will actually atrophy over time. And also with hearing loss, that increases the rate of atrophy. It just happens. It's unfortunate. But if we look at those patients with Alzheimer's and dementia, they've had, an increased reduction, a sped up reduction of the actual cells inside the brain, the gray matter. And that's just because, again, it's not maintaining the same neural connections it used to. So by just providing that back to your brain and maintaining it, we're exercising that, sending the signals in the designed fashion, so that we can use our brain the way it was originally designed to be used.
Yeah. Okay. So it's not just, it's not just, it does. Yeah. It's not just a reduction in risk. It is actual you know, not hearing can actually contribute, right, to
Yes.
your lessened ability to think and reason.
And it's not just the stimulation from the sound, it's also what that stimulation from sound gives us, which are connections to other people. We see, you know, a higher incidence of depression and isolation in patients, and that can contribute. We know in Alzheimer's patients that the more isolated they get, the less interactions they have, the less ability they have to cope with the real world that's around them. So with hearing loss, if we can help maintain our social connections by, you know, getting that sound back and not isolating ourselves because of a hearing loss, we can also reduce the risk that way. It just has so many ties in the rest of our lives here.
Yeah, very interesting.
Yes, it is. Thank you for those great questions. I appreciate that. Does anyone else have any other questions? We have about 6.5 minutes left on my Zoom timer here, but plenty of time for a couple more. Nope. All right. Well, I have one more slide here. I've just produced a new book and authored and printed. So if you'd like a free copy of our book, or my book, I should say, you can either stop in the office and pick it up or email me directly with new book in the subject line and we'll mail you a copy. But they are here available in the office if you have an appointment out. And if you don't want to wait, we're happy to send you one.
Great. I'll be getting one of those pretty soon.
All right. Well, thank you so much, everybody, for being here. If there aren't any other questions, well, actually, I do have one more question. If everybody could use the hand raising tool in your box here, or if you just want to raise your hand, if you'd be interested again, we'd love to figure that out to see if we can do some more Zoom meetings and offer some more information. Looks like we have a good show of hands. Very good. Okay. I'm not sure when it will be. Our goal is to do about one per quarter. Hopefully expand our reach a little bit. So if you have friends or family that are just interested in anything about hearing care and you know, want to learn some more about it, or maybe you're wading into the water here, or just want to learn some more, we're happy to learn and grow with everybody. So please let them know and share the link when you get it the next time. But if we don't see you in the office, see you again sometime soon, hopefully. Thanks for attending, and we will be talking to you all very soon. Thank you.
All right. Thank you very much, Doctor. Have a good day.
You too.